I was a passenger in a car,
Right.
and we were going down the highway, and a very large truck ran a stop sign going 40 miles an hour and T-boned us, and then crushed us into the guardrail. And I had something in the car flew and hit me in this side of the eyes. I had 11
When?
in 2014,
Okay.
and I had 11 surgeries in 18 months where they reconstructed my eyes.
You lost your vision, something like that.
I lost my vision. I was blind in the left eye for 6 months and partially blind, half blind in the left or the right eye for 6 months as well.
The 11th surgery. When was the last surgery?
February 2016.
And what they did mainly? What did they do?
They reconstructed the eye by putting plastic lenses in, and then also laser surgeries and reconstructive surgeries.
What's left to do? What do you have to do?
There's nothing the doctors can do anymore, and right now my peripheral vision is still off. And what happens to me was when I walk in a straight line, my eyes are pulled to the right, so I walk around in a circle.
All right. So let's try this little test. See if it works for you.
Okay.
So, all right. Close your eyes. And so you are right in front of it. Open your eyes.
Oh.
Okay.
Okay.
So you have dry eyes, right?
Very dry eyes, yes.
So this, is, I found it from this little movement we use for the membrane. And your eyes, maybe a little more. You feel already a change? Open your eyes and close.
Wow.
I think it too.
Yes.
What do you feel?
Moisture.
Moisture?
Moisture.
That's
Heat.
dry eyes. So the diagnostic and the treatment is quite fast. Now this stays for a few months, maybe 3 months, 6 months, 8 months. And sometimes you have to redo it. That's already the first. All right, so let's go into the eyes themselves. Okay. And so cornea, 5 layers in the cornea, plus 1. They just found a new layer of 15 micron called Duras layer. You have 5 layers in the cornea, and she has an impact there. So if the cornea is rotating and the eyes is not helpful, maybe everything is rotating, but she only have one eye that does this. Anterior chamber of the eyes, fluid is very stuck. Posterior chamber, and vitreous chamber of the eye, that's where a lot of things are happening. Let me confirm here. Cornea, checked it. Anterior chamber, posterior chamber is okay. Vitreous chamber is the same, there's a lot of trauma there. Now if I look at the layer, you have the sclera, that choroid, and retina. So really, I'm going to concentrate on the posterior chambers on each eye. Vitreous humor, which has a lot of different cisterns. There are different compartments that can get stuck on each other, stop fluid, and especially a little space there, that's really stuck. The lens, it's an artificial lens, and the space behind that lens and the posterior chamber, that's much better. Let's see if I can help you with that. That's better. And I can just make sure the fluid is moving in the back. Very detailed little work on the eyes, but if I change the shape of her eyes, I'm going to change the shape of her skull a little bit, position of her neck, her eyes in space, her whole body is going to change. The position of her ribs, her hip, her... So you can press on the eyes, you have a little bit of a window before you create pain. You can have some manipulation, some work, you can do some manual techniques. You want to see the periorbital, all the bones around you, they're okay. There's a metopic suture, the suture between the two frontal bones that is a bit stuck, maybe from the accident, maybe not. Did you feel something when I worked on your eyes?
Yes.
What did you feel?
Heat and fluid movements.
Okay.
There's also traumatic release happening. So
Release. I'm going on the ciliary body. Those are secreting all the fluid in the eyes. I just finish with those.
there's also a nice relaxation that's happening.
Yeah, the tension should release. It's super. You feel her? She's tense when she talks about it. Hopefully she can. Okay, let's stand up, see if I am in the right direction, see if there's a little bit of change. All right, so close your eyes now. And open your eyes. You're not going to run in a circle.
Good job. Thank you very much. Thank you.
How does it feel?
Good.
Feels
I
good?
feel actually more open this way.
And you see how the eyes are going to change. So you went from working on the body to working on the brain. That was like, wow, what a change! How can I work in such a small cavity? Now you're going to make one more step with the BEMC, brain, eyes, membrane and CSF. So you're going to go from the brain and you're going to go to the eye and work on the microscopic world, and all those structures are also going to influence a lot the rest of the body.
Good morning. I had a treatment yesterday evening by Dr. Chikly on my eyes, and I didn't realize before the treatment how rigid my eyes felt inside the eye sockets, and how dry they were and uncomfortable. This morning I woke up, my eyes feel very soft and supple, very moist, and there's a freedom inside the eyes that I didn't have prior to the treatment. I can also see better peripherally on both sides, much easier than I could see yesterday. I really highly recommend the class and this treatment, and thank you very much, Dr. Chikly, for the treatment.